Okay, anytime you're ready.
Oh, yeah. Yeah, that's good.
Wait till 2,
We have to wait till,
signing in from outside.
Oh,
No, nobody would sign in from
have
outside.
we ever had someone sign in from outside?
We did it some, we
You did?
is that a phone in?
don't have any. All right, take that back.
That's-
Well, Cindy, you said you were gonna try to make it.
Yay.
Yes, look at you all. You look so official.
No. Let's all talk on this thing at one time.
I was almost going to suggest that to leave them
Yours
all.
is on.
Yeah, I know. I was almost going to suggest to leave them all on. But
How's
then
it going? And you're gonna have to turn yours on when,
Yep, and
when
we
it's time to.
So if it can shoot more than one go on at a time?
figured it all out.
Yeah, but not all of them are something.
Okay.
Going.
How are you?
we can talk over each other.
That's right.
Glad it's Friday.
Sometimes when it's someone.
Your last night?
I'll be away.
No, I was at a concert last night.
No, I don't want
Um,
this.
I saw KT Tunstall and Sean Colvin at the Field Playhouse. So I had tickets before they scheduled them.
My pickleball?
It was fun. I've never been there. It's a tiny little auditorium. Tiny.
I haven't been there either, but everybody says it's great.
Very nice.
Who played?
Nice. Parking was fine. It was fine.
From the kitchen?
Oh, okay.
Suzette, also a tap dancer.
There.
Liz. You know Liz.
See everybody.
Two Marys. Everybody.
It's gonna be.
Yeah, the face.
Terrific. Like new light. It looked really good. I
Done a lot of work already.
saw pictures of it yesterday. Dimitri showed pictures of it. It looks fantastic.
Ron, I just got a text from Michelle a few minutes ago, and she said Ronnie is leaving early. She needs to stay and cover the office.
We have a copy of her notes to read.
She sent her apologies and said she had sent. Just wanted to make sure that we knew she wasn't just,
Didn't give it-
you know.
Taking off on a Friday afternoon.
Yes. Well, she's entitled to do that too, if, you know, if she needs.
Not today.
That's not when people are expecting you to be somewhere else.
2 o'clock.
Go ahead.
Okay, it's now about 2 o'clock. We're going to start our Commission on Aging meeting with the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, we'll now do a roll call. Thank God, where are my notes about this thing here? Okay, who do I see is here? Yeah, this will be good. Linda Randall,
Yes. Here.
Nancy Lucas is absent. She informed us she was. Mark Ryan is here. Eve is here. Alyssa is here. And I don't see Eve or Nancy. Well, we have two Eves.
Abby's not here.
I say Eve. Evie?
This is Eve. Evie's.
EVE, Evelyn. Sorry, I stand corrected. I apologize.
No, that's right.
Okay, so guess we have that out of the way. Today we're very fortunate to have a guest speaker. Now, Barbara, you were instrumental in kind of helping with this, and I would appreciate if you would take a little introduction, if you would, to Commander Bassett, is it? Commander? Captain?
Chief.
Chief? Sir? Take it, Barbara.
Well, I think you did a good job of introducing him. This is Colin Bassett. He is the new chief of Trumbull EMS. He's been around since like November timeframe. And I will turn it over to him. He's here to talk about EMS and answer any questions.
So thank you all for having me. Thank you, Barbara. As Barbara said, I assumed my role as chief of EMS for the town of Trumbull in the end of November. Previous to that, I spent the last 8 years I worked down at Greenwich EMS, where I was an operations supervisor and then director of quality assurance and EMS coordinator for Greenwich Hospital. So I left that job the Friday before Thanksgiving week, and then started my job at Trumbull the Monday after Thanksgiving. So I took a lot of time off between the two. I am a Connecticut resident originally. I grew up splitting my time between Stratford and Woodbury, Connecticut. I went to college in Vermont, and that's where I got started in EMS. I got started in rural EMS in the hills and woods of Vermont, and then pretty quickly immediately transitioned to paramedic school, and then began working urban EMS in the city of Cambridge, right outside of Boston. Very small city, only 6 square miles, but extremely busy, close to 50,000 calls a year, so about 10 times more calls than Trumbull does in a year. But very busy, and I did that for a number of years prior to, my wife and kids were just like, hey, let's go back to where I grew up. So, here we are back in Connecticut, and many years later, here I am with you. And I put together a quick presentation to go over some things that I think are important, some things that I would like, you and the general public to kind of know about EMS. And Trumbull EMS specifically, and then answer any questions that I'm capable of answering. Am I good to go right into it? All right, thank you, Richie. We figured this out. We got it working. So some of the things that I'm going to go over today. So just some information on the service, what we call ALS versus BLS. I'll get into depth about that. Some statistics, data that we monitor, staffing, the protocols. So kind of what gives us guidelines to how we treat patients and what sort of things we can do, and how that's broken down statewide and even smaller. So this is I guess I am clicking buttons by accident here. This is the mission statement for Trumbull EMS. So it is the mission of the Trumbull Emergency Medical Service to provide prompt and efficient pre-hospital emergency medical care and transportation to all in Trumbull who are in need. So Trumbull EMS was founded in 1976, and it was a volunteer agency only. We still have a very large volunteer contingent today, and that's that's great. That's how I got my start in EMS, was volunteering, and it's for me it kind of piqued my interest, and I haven't left since. And we still have a pretty large volunteer contingent today. Our headquarters is located at 250 Middlebrooks Avenue, right near the school. And that was erected in 1978, and we are still there today. And in 2020, Thames Trumbull EMS became a municipal agency. So prior to that, paramedics were brought in from outside staffing agencies. They would provide the people, and Trumbull would provide the equipment, the ambulances, and scheduling and sort of the back end there. But now we are a municipal agency. Our full-time employees are town employees, and that's to me that's huge. That's not something that's very common in EMS, but it is very progressive, and I think kind of the step forward for EMS as a whole is to be part of the town with the people that they take care of. Yeah.
I don't know if it'd be appropriate to interject it when a question comes up, because you're saying a lot of things that are very interesting. But you're saying like some people are salaried and some aren't. Like how many salaried people do we have on EMS?
So we have 4 full-time positions for paramedics, 4 full-time for EMTs, myself, a deputy chief, 2 captains, and an administrative assistant.
So it's about 15 people or so?
Yeah, full-time staff.
And how many volunteers do we have?
Off the top of my head, right now we have probably, I think, 6 to 10 that are active, and many more that are still involved on some level, not necessarily on the road. And we have volunteers dating back to when Thames first started that still show up. I don't know if anybody knows Vi. She's never one to not be stopping by and hanging out. So we still have a lot of people that maybe aren't active on the ambulance, but are still active within the organization, active within our honor guard. So if we have, parades or, God forbid, funerals that, we send representation to, that our volunteers are the ones that man the honor guard. They wear really nice uniforms, and they practice how to stand at attention and the whole sort of process, and that takes dedication and commitment as well.
I don't know what your schedule is, but we could talk all day about this, and I don't really know how to jump in or not jump in with some curious questions that come
Sure.
up. Okay, the question that I then have, I guess, is the impact, for the sake of argument, of the new development by the mall. Has that impacted you in any way as far as over and extra activity or calls and things, or?
When it's full capacity, I mean, I have statistics on our call volume. So all the things that are happening in the town are for development, for housing and property. They do increase our call volume and what the needs of the agency are. Some of the big drivers. I mean, I'm sure you noticed the amount of health clinics and specialty health centers that are being put up in town. 5520 Park Ave is a great example. That's there's a lot of medical offices there. They do day surgery. That's very often we do get a lot of calls there, and there's more that are going to be coming into this town. It's a pretty desirable area to have those sort of services for people. I mean, Fairfield County is a pretty big county. Very, very wealthy, very heavily populated. So there's a ton of health services that are coming in, and that will increase our call volume. And I'll get into some statistics as we go.
Okay, and maybe hopefully in the statistics you'll maybe broach on the subject of at what point do you need additional personnel to handle the volume?
Yeah, I will get to that.
Can I ask a question?
Sure.
When you go on a call,
Microphone.
yeah, I don't need that.
The video, you should.
When you go on a call, is it going to be volunteers and full-time person on each call, or what is the breakdown between who goes on calls?
So when an ambulance goes out, that ambulance will be paid personnel that are on that ambulance. If
Only?
there's a volunteer, they will be in a capacity of a third rider, like an extra attendant on the crew. And then we do have the option if we run into, say a staffing emergency, everybody gets the flu. We do have volunteers that can join with a EMT and then make a whole ambulance there. But primarily the volunteers will go out as an extra attendant with the crew.
What's the requirement of their qualifications to be a volunteer and go on a call?
If they are going to make up a crew with, say, a paramedic or an EMT, they have to be a minimum EMT. By Connecticut state statute, there needs to be a minimum of 2 EMTs on an ambulance. There is an EMR certification. It's like the very bottom of the emergency medical certification. They can't go out with another person. They can go out as a third rider, or they can first respond, but they can't make an ambulance, if that makes sense.
Okay, thanks.
Yep. And again, we do have a combination staff. We have an EMS commission that we report to, and we report to the Office of the First Selectman as well. So some information about our service, kind of touched on that. So we have 5 ambulances and 2 fly cars that have gear in them that are ready to go out. We have 24/7 paramedic level coverage, and I'll go into the differences between paramedic and EMT because they're pretty significant. A 3-2-1 model, 8-hour shifts, days, eves, nights, and when we need to, when we have to. Our team is great and willing to come in and help out when if we're busy during snowstorms, large scale events, things like that. Large dedicated group of providers that we have. People really like to work here, which is good. I enjoy it as well. But we do have a pretty selective hiring process for the people that we hire on full-time, and very small writing up there. But the first thing that happens is an online application. And then when those applications come in, those applications are then graded based on completeness, information that's put in. That data is aggregated, put into a spreadsheet. So from that initial application to the review, that's the first selection. And then candidates, either EMTs or paramedics, are brought in for testing, both written testing and practical testing. So they have to demonstrate competency in some difficult scenarios that are provided by people on our team. And then after the testing process, if they pass both the written and the practical portions of the test, they then come in for an interview with, myself, deputy chief, captains, somebody from HR, and then often they're given another scenario there, kind of a different scenario, more of a how do you sort of plan like for a large event, or if you have a lot of people injured at one time, sort of what your process is and how do you triage, because that's also important as well. And then after getting through all those steps, they are given an offer if we feel like they demonstrate the values and characteristics that we look for in somebody that works for us. They're given an offer. So it's fairly selective, which is good. I like it that way. I want to make sure that in line with our mission statement, that the people that work for us are the people that are providing the best care, and can demonstrate that prior to being hired. So that's kind of the hiring process if you do apply to work. It's very thorough. So I mentioned ALS and BLS a lot. So very simply, ALS means advanced life support and BLS means basic life support. So ALS would be paramedic and BLS would be EMT. So I'm a paramedic, so I'm an advanced life support provider. So some examples of a BLS level call, minor cuts, minor injuries, minor illnesses without any sort of other complications, falls, a broken bone if it's not complicated fracture, maybe if it's only one bone, and I put childbirth on there, even though everybody would like to say let's get a paramedic for childbirth. I had a very great instructor and mentor that I respected very much, who always used to tell me when I became a paramedic, he's like, you don't need to be a paramedic to bring somebody into this world. People have been bringing people into this world long before people even knew that there was going to be something called an ambulance. So if they could do it, you could do it too. But we generally do have paramedics for childbirths. But I always tell my EMTs, like, you can do this. I can do
I
this.
said if that happened to me, they're in trouble.
That's right. Yep.
Self-doing it.
So, and EMT training, the course for EMT can be done in a very short amount of time. Generally, it's about a 4 to 5 month course, combination of evening classes once or twice a week and weekends. They do have accelerated programs that, they can get somebody their EMT certification in 4 weeks, sometimes less. And that can be done really quick to kind of get that first step into emergency medicine. Now, ALS for paramedics, we are licensed medical practitioners in the state of Connecticut. I have a license that's a state of Connecticut Department of Health paramedic license with my name on it. That's a lot more in depth. That requires 1 to 2 years of schooling. And generally, mine was 13 months and it was full time. I was there 4 days a week plus weekends and one night for 13 months. And probably a lot more because you had to do clinical time too. So the clinical time is a component, 500 hours in an ER with a doctor. You have specific amounts of time on an OB floor, you have ICU time, you have ride time, you have patient contacts that you have to make. And there are courses now that offer college credit, and there are college level paramedic courses that also offer associate's degrees in paramedic. There's some that are now creating bachelor's degree programs that you go through 4 years, and at the end you have a bachelor's degree and a paramedic certificate. And the difference is the advanced techniques and knowledge that you learn. It's going right now. The advanced techniques that you learn. So cardiac monitoring, taking a picture of somebody's heart, like an EKG. I can print those out as a paramedic. You know how to take them, you can read them, you can interpret them. I can tell you what rhythm your heart is. I can tell you what medication I need to give you to either slow that rhythm down or speed that rhythm up. If you are having trouble breathing and you have gotten past the point where we're not going to be able to, coach you or give you medicine or bag you, I can sedate you, I can paralyze you, I can put a tube in your throat, I can keep you unconscious and comfortable and breathe for you. We do IVs, where we, if you've ever been to the hospital, if you've ever been to your doctor, they draw blood, we do that. We put fluids in, we put medication in. We can even do intraosseous access, so we can do access into the bone. There's 2 sites, so we can drill into your humerus or into your shin. It works really great, I promise. And we can give medications that way.
People who are not as qualified? It's annoying. So say on a call, you always have someone at your level? Is it like at a hospital where a PA, a physician's assistant versus a doctor? A doctor can give medication, PA cannot. Is that the same thing with you? Your qualifications, you can give drugs, the other person cannot?
So with a paramedic, you can give drugs, an EMT cannot. So I can, there's a massive formulary of medications that we are allowed to administer as paramedics. Some are narcotics, some are not. Lots of cardiac medications, respiratory medications, medications for breathing issues, both inhaled, intravenous, lots of different techniques. So the way I say it in this line here is that if you call 911, there's no emergency that a paramedic cannot handle. So we're doing a lot of the similar techniques that you would have done in an emergency room. Intubation, IVs, lines, managing a cardiac arrest. Those are things that are often done to stabilize somebody in an ER to get them to a higher level of care. And in EMS, we get the patient, we stabilize them as best we can, get them to the hospital for further stabilization and then recovery. And the way that I always say it is, a doctor and I can do a lot of the same skills. The difference between me and an emergency room doctor is all you have to do is get me to the patient. It doesn't matter where they are. It doesn't matter if it's raining. It doesn't matter if it's dark. It doesn't matter if it's upside down. It doesn't matter if they're in a tunnel. It doesn't matter if they're, under a tree limb. If you get me to the patient, I can do the skill. All you got to do is get me to the patient. I don't need a nice hospital bed. I don't need bright lights. I don't need warmth. I just need to get to the patient, and I can do what I need to do.
How many of you are there?
We have 4 full-time, and then about half and half for our EMTs and paramedics, for our part-timers as well. So there's a lot of us out there.
But with your unique capabilities, though.
Every paramedic. Yeah, so that's kind of the difference. Like, all paramedics can do what I do. And not to knock, not to say that a paramedic is better than an EMT. One of my I always used to tell people that being an EMT is harder than being a paramedic, because as a paramedic, I'm hiring you, or I need you to take care of the patient. That's what I need you to do. You're the highest level of care, take care of the patient. But if you're the EMT, you may not be doing all those skills, but you're more of the operational end. You need to find out if we need more ambulances. You need to get those ambulances here. You got to tell other people where to park. You got to figure out how to get to the hospital. There's so many other things that an EMT does on the scene. That's why, being a paramedic, I say it's kind of great, because I just know I got to go take care of the patient. I don't have to worry about where to park the ambulance or where to park anybody else. The EMT acts in that sense. If we have a critical patient, they're the operational wing of the agency. So
It's a team.
yeah, exactly. If I'm taking care of somebody and my hands are tied, and I've got a ton of things that I'm trying to figure out, trying to diagnose what's going on. I have somebody else who's communicating with the group as a whole, figuring out what next steps are to get the patient where they need to go.
Gotta have that.
Do you have a relationship with any of the other towns? God forbid there's a major thing that goes beyond the capabilities or the numbers that you have, that you could call in Stratford or Bridgeport or something like that, and vice versa. Do they have that relationship?
Yeah, totally.
They
And
can
I'll
do that for you?
Yeah, and I'll get to that a little further. I just want to continue on. So sort of what designates how I can, EMTs and paramedics can operate. So we have the Connecticut statewide protocols. They're based off national scope of practice models, and they're provided to states for use. So it's they basically say what we can and can't do as far as treatment, like our scope of practice, what meds we can't do, and it differentiates between even from EMR all the way up to paramedic. And these are modified yearly. I'm I'm part of several state groups that we kind of look at protocols both regionally and statewide. REMAC, ChemSMAC, just there's a bunch of agencies. We're all kind of talking together and going through best practices for evidence-based medicine. So evidence-based medicine means that instead of just saying, well, we're going to do this because we've always done it this way, or we're going to do this because the book said to do it, is that the way that these protocols are changed every year is based on actual data. So if we're noticing that we're giving a specific medication, that medication is having a better effect because we have the data to show that, then somebody, myself, anybody from service can be like, hey, I've come up with a proposal for a new protocol to do this, and then it'll be vetted and researched, and then that's how a lot of the protocols we have today have made it into the state protocols, is based on research and based on best practices. So every year they release a new update, and it's they change a little bit here and there. Sometimes they add completely new things. And then further down from the Connecticut protocols, you have your sort of sponsor hospital group. So in Trumbull, we are under the Greater Bridgeport Sponsor Hospital Medical Control. So in order to practice under my license, I have to not only, when I get hired somewhere, demonstrate to the people that are hiring me that I can do the job, but I have to demonstrate to the sponsor hospital, so the emergency doctors that sign off and say that he can go out here and do these things that he's trained to do. You have to go through an interview process and a testing process with them as well.
Does the sponsor hospital, is that the first point you would take an injured person to? Like, how does St. Vincent's play into that?
So St. Vincent's and Bridgeport they're a council together. So they form the sponsor hospital of Greater Bridgeport. So it's both of those hospitals working together. They each have an EMS coordinator, somebody whose job at the hospital is to make sure that all the EMS agencies are doing what they're supposed to be doing, best practices, a lot of data gathering for what treatment we're doing, what our outcomes are in the hospital. So they work together. So we work under that group. They're the ones that if you want to work in this region in the Greater Bridgeport area, you have to go through them. So like if somebody gets hired at Trumbull and they say they came from Hartford, they would have to go through the interview process at the sponsor hospital to get signed off to be able to treat, and then also our internal process. So kind of, there's your paramedic education, your national standards, your Connecticut state protocols, whatever sponsor hospital area you're in, and then, the company you work for. So it's, kind of goes all the way down, but it works actually really well. And it's a great way to have checks and balances on all things. Yeah.
I don't know if you're going to get to this or not, but how do you determine which hospital to take the patient to?
So we're really lucky here in Trumbull. We have Bridgeport and St. V's that are both trauma centers, and they're both capable of handling stroke. So it's really kind of like on that scene, whichever one we're closer to, or whichever one the patient wants to go to. Like if somebody says we want to go to St. V's, that's fine. There's nothing that's going to happen at St. V's that couldn't happen at Bridgeport, and there's nothing that's going to happen at Bridgeport that couldn't happen at St. V's. And both are connected to, massive hospitals in the state. So say if we bring you to, Bridgeport, and they say, well, you need higher level care that we don't necessarily have right here, right now, then they would say transfer you potentially to Yale. And same thing with St. V's. If they're like, we don't have right here, right now what you need, but they have it at Hartford, they could transfer you to Hartford. So it's a lot of interconnectability in the state. And trust me, this is a great area to live if you ever need to go to a hospital, because you have like two of the best in one town over. So, and I always tell people, like, going to the hospital is never fun. I mean, I like it because sometimes they give me food. But people are like, how long am I going to wait in the ER? And I'm like, I hope you wait in the ER for 8 hours. And they're like, why would you say that? I was like, because that means you're going to be okay. Like, you're going to be okay. And if you're going to be fine, you're going to wait. And that's okay. So I always tell people, bring a book, bring something. The longer you wait, generally the better off you're going to be. having had my own experiences and then working in this, when people come rushing into your room, because whoa, why are you coming in here? Like, I feel fine. What's going on? So it's okay to wait. And again, like, patient choice is like, really doesn't matter. Either hospital from whatever part of town, I can get to St. V's just as quick as I can get to Bridgeport. It doesn't really make a difference. If you're like, I don't ever want to go back to Bridgeport, that turkey sandwich was terrible, I'm like, that's fine, we'll go to St. V's. It's definitely patient choice. So getting to hospitals, some common questions that, people always ask. So I said hospital of choice, that's patient choice. A lot of times we'll do it for continuity of care as well. So if you are let's say if you're a Hartford Healthcare patient and your doctor's a Hartford Healthcare doctor and you go to a Hartford Healthcare urgent care clinic and you're like, what hospital should I go to? I'd say if you want to stay in the network where all your doctors are, St. V's is definitely appropriate, if people are unsure. If they don't know because they've never been to a hospital, like, which hospital should I go to? I'm like, well, where are you followed? Are you followed in the Yale network, then Bridgeport's a Yale network hospital. If you're followed in the Hartford Healthcare network, Hartford Healthcare is St. Vincent's is a Hartford Healthcare network hospital. So continuity of care is important. But again, not the end of the day. If you're a Hartford Healthcare patient and you go to Bridgeport, you're still going to get great care, and they're gonna figure everything out. Like, we're good at communicating, and so are they as well. So lights and sirens versus no lights and sirens. So the way that sort of gets predetermined for us is if you call 911, you're going to get to a dispatch center, and they're going to ask you questions. They're going to ask you a lot of questions, and they're going to seem ridiculous. If you call 911, if I called 911 right now and said, I need an ambulance, they're going to go right to a script that's going to force them to ask questions. And I'll kind of explain why. But it'll say, like, I need an ambulance, I broke my finger. They're saying, okay, are you breathing? Yeah, I'm breathing, I'm talking to you. And it's going to seem kind of ridiculous that they're asking those questions. But the importance of having those questions is it removes a lot of the human factor of it. So I'm not on the phone, not seeing you, deciding, what do I think's going on? Like, do I really think that your arm's broken? Nah, maybe not. Maybe I can hold off and slow down an ambulance. So, it sort of removes that, external influences factoring into a decision that somebody would make in an emergency. And it's also good for, data collection as well. I keep mentioning data collection. So data kind of drives us how we move forward. So based upon the questions that they ask and the system that they use, it's going to determine whether or not a lights and sirens response or a no lights and sirens response. For example, like if I stub my toe and I call 911, it may hurt real bad, but I'm going to call 911 and they're going to say, maybe we don't need to go lights and sirens. And they would send me non-lights and sirens. And I can tell you there's tons of data to back up that the second you turn those lights on and you pull up behind somebody, their IQ drops 40 points. Everybody in this room knows, well, you got to pull over to the right and make way. I have had people pull to the left, stay in the center, go in reverse, speed up, try to race me. So there's a lot of dangers that you can kind of add when you use those lights and sirens. And also for patient care levels too. So for example, if somebody's having, let's say, a heart attack, and I got to get to them to the hospital, I'm probably only going to save, 30 seconds to a minute going lights and sirens, going down main roads. But using those lights and sirens, what I actually might be doing is increasing your stress and anxiety level, which is then increasing how much more oxygen your heart needs to work, because now your heart wants to breathe faster because your brain's like, hey, we should be scared. He looks scared. So, I kind of look at things like that, when we determine how we're going to get somewhere. And I've taken, me and a lot of the people that I work with, we've taken some of the most critically ill patients to the hospital with the flow of traffic, because we know that speed isn't going to really help us in certain situations. In situations where we would use it more frequently, strokes, for example, because we know that time is tissue. So in those kind of situations where we're running into a person who is sick, where time is a factor in, their potential outcome is when we would utilize them. And primarily that's just to help us get through traffic. We're not breaking the sound barrier. We're driving 14,000 pound squares down the road. They do not handle that well, and they do not brake that well. So, it's not a Lamborghini. So we try to, we operate within due regard. Yeah.
2 questions. Are you able to divert now? I mean, in the past, you were not able to divert if you got that broken finger and then you got the heart attack after you went to the broken finger. And my second question is, if somebody's on a HIPAA form, their name is, your wife is on your HIPAA form, are you allowed to say which hospital you're going to if you happen not to be with your wife when the ambulance comes?
So the diverting question. So yes, if a priority call came in, and nobody had made patient contact, like say I get dispatched to a broken finger and Barbara gets dispatched, or a heart attack comes in and I haven't left yet, I'm not there yet with that patient, then I would divert to the priority call, and then another ambulance would go to, say, the broken finger. And that's system status management. That's pretty standard. And dispatch is pretty good about doing that as well. Sometimes they'll be able to recognize that, like, hey, I've actually got a priority call, or if another unit clears, hey, we're en route to this call, would you like us to go to this call? Would be closer. So we can make that decision on the fly. We don't need to really change anything to say, like, we're not going to go to we're going to let the priority call wait while we continue to the broken finger. However, if we're at patient side, if I make patient contact, then I can't really leave you. Like, I can't say, well, I've got a serious call here, I have to leave. That's technically patient abandonment. I wouldn't be allowed to do that. You can't. It's really bad. Not only is it against the law, it's also very much frowned upon. So if I show up and I say, like, hey, I got a broken finger, I'd be like, great, I've already made contact with you, so I've technically already started medical treatment. Like, the second I walk in and say hi to somebody, I'm already, like, assessing, a whole bunch of different things. If you say hi back, well, now I know you're breathing. If you're talking, I know your airway works. And, if you're standing up, well, your blood pressure is probably decent enough to support you standing on your feet. So I've already, the 3 main things that I'm going to be concerned about the most in a really sick patient, I've already identified just by shaking your hand and saying hello. Shaking your hand, I can tell, is your hand cold? Is it warm? Is your skin clammy? Is it dry? All these things that, just a simple greeting can give me all that information right away. So I've already started medically assessing somebody when I walk in and say hi, and I can't walk away from them.
I feel like, oh, I'm sorry.
The second part, if
With
somebody's
HIPAA?
on the HIPAA
Yeah.
form, we don't usually get a lot of HIPAA forms, but it's generally next of kin that we'll, communicate with. I don't, telling somebody what hospital they're going to is not necessarily a violation of HIPAA, because I'm not telling you what I'm doing or where they're going to be going. Like, if you're like, what hospital are you taking them to? That's sort of, I look at that as like a continuity of care, and if somebody's a next of kin, that information would be passed along. And then if you're, let's say, a next of kin and you're on scene and you're, unfortunately, like, if the person that you're with can't communicate for them, well, you're communicating on their behalf, and we're trained to utilize bystanders, and then you're kind of involved in that healthcare. I can't go to the hospital and then come back and say, hey, guess what they did when they got there? That would be something that I would not be able to do. But I would certainly be able to say, we are transporting to XYZ hospital. And that information isn't necessarily HIPAA protected. So if you were to use the Freedom of Information Act and contact CMED and say, hey, I want to know how many calls Trumbull did, and which hospitals they went to over the last 2 months, you could just ask me. But if you didn't want to do that, if you went through our dispatch center, there's no patient information on there. It would just be, dispatch times and hospital destination and priority of the patient as we called in. But it wouldn't have any protected health information on that report, if that makes sense.
Though I had a case of a good friend of mine had a stroke, and he was at Milford Hospital, and he was being transported that day to a rehab place. So I went to the rehab place to find out if he was there, and they would not let me know that whether he had left the hospital yet and is on his way. So I called up the hospital for HIPAA reasons. So I called up the hospital and asked them if he was still there, and they would not let me know whether he left yet.
In that situation, if you're calling like a hospital to get patient information, they're not going to tell you whether they're there or not, unless you're on like a next of kin list.
What happens if you're transported?
If I'm-
What
if I-
happened with my mother in AMR, they would not tell me which hospital they were taking her to, and I was able to find out connections.
Did you call? Were you on scene, or did you
I'm not
call?
on scene yet.
Yeah, I don't know why they wouldn't do that. I mean, you know, that's not necessarily a HIPAA violation. If you're a family member and you're trying to find out, you know, where the patient is, you know, we would say we transported to St. V's. I wouldn't tell you what we did. Like I wouldn't be able to.
I knew it was
Yeah, like I
what
wouldn't.
they were doing. I just wanted to know.
Yeah. I mean, that's not protected health information. As far as I'm concerned, and I've done a ton of HIPAA training and never had anywhere say like you can't say what hospital you're going to.
That may be just.
I mean, that could be.
Ambulance policy.
It could be their policy is not to communicate with anybody. I mean, they're a commercial service, so they're run a little differently than we are. You know, I don't know all of their policies, but as far as a HIPAA violation, I don't necessarily for like a family member to know where their family member is going.
And then you've been paranoid about getting in trouble too.
Yeah.
My name is on every one of her.
I have a question. It seems that one question begets so many other questions,
yeah.
and there's so many different points of interest, especially from my point of view, this fascinating awareness of what the hell is going on. And you mentioned it a while ago about sirens and lights,
Yes.
and I guess, Cindy, you might be involved in this a little bit. Are we getting into the smart lighting system, like for a fire engine running through multiple lights where he can coordinate the lights for his process down the road?
So like an Opticom system. I don't know if there are lights in town that have them or if our ambulances do have that. I think that our light packages may have that capability, but I don't know the working, how well they're all working, if they are working or if they're even in place. Actually, that's a good question. I could find out.
Then just as a little sort of, has traffic ever affected you in that area? Like just crazy people going through?
It's something that we're always cautious for. So even if we had smart lighting, the best practice is to slow down or stop when you approach any intersection, because you don't know, and me personally, just the other, couple weeks ago, I had to go out on a call with one of my employees and pulled up to Route 25 and 111, and we're on, we stop even though our light was green, and the semi hauling garbage, like coming down 25 from the high speed section, he flat spotted his tires all the way through there. Like, we stop because we know, like, we want to make sure everybody in that intersection can see you before you proceed. So yeah, I mean, even with smart lighting, what smart lighting will do is it might change them in succession, but then if you drive in this town and you're used to how the lights work, you know that this light, and all of a sudden, wait, I shouldn't be getting a green right now. Like, you still, it's always confusion. I always say lights and drivers equals confusion, even if it's regular traffic lights. So you always got to be careful of that. Yeah.
The senior center where it is now in Priscilla Place, I know you're there often.
Yeah.
Are there accessibility issues? And I'm sure you make do with what you have, but are there accessibility issues for the ambulance? Thank you.
I have not had any complaints from the staff on accessibility issues for the senior center. But, if anybody knows of any, like I said, reach out to me. But it seems to work pretty straightforward. And then that turnaround in the back. So you kind of have like a couple of options of how you want to, depending on where the patient is. If they're on the lower level, then you can drive around the back and you don't have to worry about going up or downstairs. And if they're on the upper level, you can drive around, turn around and park street side if there's parking. And then you can get in on that same level too without having to go up and downstairs. I try to avoid stairs as often as possible. I wanted to go over some insurance information. So our insurance rates are set by the state of Connecticut. They set the maximum allowable rates, and I have them listed right here. So for a BLS, so an EMT and another EMT, or ALS, so if I'm in the back taking care of you as a paramedic and doing paramedic level things, or let's say, if we're very busy and we have another ambulance come in and maybe they don't have paramedics, but we have one available, so a paramedic intercept, I could go to that call. Or if, say, Easton calls because they need a paramedic, we can send a paramedic into Easton or Stratford or any of the towns around. And there is a charge, like if we go to somebody's house and we perform, like if somebody has low blood sugar and we give them glucose and we get their blood sugar up and they're back to normal and they say, I don't want to go to the hospital with you now. There is a avenue to bill for a treat, no transport. A bit cumbersome, but we work with our insurance agency, and then a per mileage charge. So those rates are the same with or without insurance. Those are the maximum allowable rates. Some debates, or not, some issues that I run into with insurance, or people understanding, is there's deductibles are always a big thing. Like an insurance company will pay, whatever they want to pay for it, but they then say you have to pay them $250 because that's your deductible. Or co-pays, or a lot of the ones is out of network. Well, they're not it's an out of network ambulance call, and I kind of say, well, nobody knows they're going to have an emergency, so it's hard to say, call up Trumbull and be like, hey, just so you know, I'm going to cut my finger real bad tomorrow. So can I schedule an ambulance? That's not how the world works. So one of the ways I kind of, if people call in, they're like, hey, insurance saying this is out of network, you're not paying this. We work with our billing company, QMC. I have monthly meetings with them. I have one specific person who handles Tremblay EMS, who I work with monthly, and is always great answering out. And a lot of times she'll have, this is what insurance paid, and she'll reach out to other insurance companies and maybe try to get them to reprocess the claim, saying that it's not out of network, or, working with people like, some insurance companies will say, we'll only talk to the patient, having whoever the patient was or who was a representative call in and say, hey, this was an out of network. You said it was out of network. However, it was an emergency. Can you please reprocess this claim? So there's things like that can help out with that.
So if I understand what you're saying, that there's absolutely no difference in the charge, what you charge, whether the person has insurance or doesn't have insurance. But obviously, if they have insurance, then you'll try to negotiate a better deal for what the insurance company is going to pay.
So we won't negotiate for a better deal. So that's where that term maximum allowable comes in. So for example, like the cost for a paramedic is $1,500 and some change. Now Medicare and Medicaid won't pay that. They have, their state and federal programs. They'll only pay a certain portion, and you can't get them to pay more.
And if it is not covered by the insurance,
Insurance, then you will bill the individual the difference?
So for some of them, you're not allowed to balance bill the patient. You can't bill the patient for more than what Medicare and Medicaid won't pay,
Well,
because they're only allowed to collect a certain amount. Same thing with hospitals as well. And hospitals do, like, they have certain ways of trying to get that money back, but Medicare and Medicaid and a lot of insurances will only pay what they are federally obligated, or state level obligated to pay.
And you accept that.
Yeah, because we can't bill them for more.
But then if the person doesn't have insurance, you're going to give them the full bill. So in theory, and I may be wrong, a person without insurance could wind up paying more for whatever procedure was done than a person
So
with insurance.
the cost of the bill is more, and I don't know the entire specifics. Like, so the bill price versus what's collected, like that would all get worked out with the insurance. So one of the things that, like, for financial assistance, if somebody, we run into this fairly frequently. So a lot of times people go to the hospital, they won't have insurance, and the hospital will give them X amount percentage discount that they agree on, and then once the hospital figures that out, then we match that. So we would match the whatever agreement that the hospital came up with, and we do have payment plans. And then if somebody doesn't have insurance, the insurance company can negotiate like the cost with those people as well. So there's a lot that goes into the back end. It's not just like if you have insurance, I come in and say you owe me $1,000 or else. There's plenty of avenues to sort of work through that. Because we do get, our budget, what allows us to operate is all through insurance billing. That is the lion's share of the ambulances you see on the road, the equipment that goes into them. A cardiac monitor is $36,000. We have 4 of them, and we need those. Like we can't operate without those. Stretchers, $20,000, $15,000 for a stair chair to carry somebody in and out. $15,000 for the machine that brings the stretcher in and out of the ambulance, $17,000 for a device that can do CPR better than any human I've ever met, not to mention all the medications that we carry in the ambulance. That's, hundreds of thousands of dollars worth of equipment that comes on every ambulance, and not to mention the people that are on there. There's a cost for the people as well.
So is Trumbull considered a not-for-profit EMS system?
We're considered a municipal EMS system. So we don't have a non-for-profit designation. Any money that we make over what our operating budget is, and if you look at the town budget, you'll see like there's maybe I forget the difference off the top of my head, but anything that we bill over what our operating budget is, and we try to be as fiscally responsible as we can, that money goes back into the general fund. So it's we're not a revenue generating, we're not making a profit. We're not turning a profit. That profit doesn't come back.
Well, like Bridgeport Hospital is a not-for-profit hospital. Trust me, they make money.
They do, right? Yeah, they make money, and but they don't, they're not considered a for-profit. And the money that, the revenue that comes over, anything over, goes into the general fund for the town. But we try to cover all of our operating costs and make sure that we can cover our operating costs. So that's that's kind of how that system operates. But we're not designated like a 501c3. We don't have that designation. We're a town service. And most other town services in the state of Connecticut are either fire-based or strictly just volunteer-based, and kind of get when you get in the rural areas of the state. So here's an example of one of our vehicles. So this is our newest one. It's 903. It's a Sprinter type. Safety is something that is very important into designing a vehicle, and then also making sure that it's a ALS equipped, so if paramedics there, that they're able to do everything they can do in that environment, along with maintaining costs. And just to kind of show you where the state is going, at least Trumbull EMS, I have some statistics for you. Just total incidents and transports. So again, we don't transport everybody that calls 911. Some people, we can treat them, take care of them on scene, and then, say, we'd love to take you to the hospital, but we understand that if you don't want to go to the hospital with us right now, that's within your right. So we've just kind of broken down from 2022 to 2023. So 7.9% increase in call volume and a 7.1% increase in transports. And that trend's continuing. And it's not just Trumbull. It's like, it's every town that I could throw a pin in on a map is they're all having more and more patients. Yeah.
That's blended against the population. Cindy, the population of Trumbull in that same time period got up.
No way to know.
Is there any correlation relative to age for that number of calls? Because it seemed like I'm trying to mentally divide out the number of vehicles into the number of calls, and just to get some perspective on that. I mean, does age of senior citizens utilize this much more than the norm,
yeah,
or?
Yes, and that's kind of a nationwide. As medicine advances, as people get healthier, they don't get any younger. So that 65 and up, that 65 and up age group is that 65 and up age demographic is the largest growing, continues to be the largest growing demographic. So that it's a very large portion. I think the town of Trumbull, 59% of our patients are Medicare. So 59, yeah. Yeah, so that's a pretty large portion. And Connecticut in general, by the way. Yeah. So Connecticut in general, again, a very large population of 65 and older. More so than a lot of other, this is one of the things that when I talk with my billing company, she's like, I can't believe like the number of patients on Medicare in the state of Connecticut. It's like that, it does. I'm like, well, I mean, I don't know if she works in Florida, but so some other things that EMS does, we do community training, CPR, safe sitter courses, Stop the Bleed. We do continuing medical education for all of our staff so that everybody's getting, up to date on, what sort of new trends there are. We do large scale events, Trumbull Day, Trumbull graduation, Memorial Day parade, and coordinating with, police and fire marshal's office and, whatever venue we are working on, and to, pre-planning. We use the FEMA's incident command system to plan out how we are going to approach and operate an event and what sort of resources we're going to need at that event. AEDs in the town, we work with the health department to track and make sure that all the AEDs are in the town. So it gives us a Heart Safe designation, the state of Connecticut, Heart Safe community, based on the number of education programs we do and the number of AEDs we have in the town. Yeah.
Quick question relative to AEDs. Are they powered when they're mounted on the walls?
They have an internal battery, so that is not powered to the wall.
So the batteries have to be checked periodically by somebody of...
Yep, and that's
Okay.
done through VOC through the town.
Okay.
That's checked and managed.
For some reason, we had
She had the AED device, and she kind of opened it up, and hello, this is what you're going to do.
Yeah. There. So
And how, I thought for some, there might be like a little drop-in charging automatic station in it, but apparently it's just strictly battery.
strictly battery. Yep, and they'll last. So the batteries last a very long time. That machine in particular, that's I believe that's a CR2. So that has a battery bar on top. So that is an interesting battery. It has a external battery and an internal battery. So the external battery, you can see the bars on the top. The external battery will trickle charge the internal battery to make the internal battery last longer. That's the only one that I think does that, and the newer ones don't. The battery technology gets better, and they last 7 years now, sometimes longer.
Should have a thing like your smoke detectors, where you start, it starts beeping, so you...
Some of them do. Some of them will. They'll flash a light or they'll make a noise. So you would see on that one where it has 3 bars and it says an OK, it would have 2 bars and it would show a battery symbol. And people used to call all the time and be like, my AED's not working. And it's like, no, I mean, it's still good. It's just, you have to replace the extra battery. And even if that's down to 0 bars, it'll still work. The internal battery, it has a limited number, but it would be able to administer at least 1 defibrillation. So like you mentioned the mutual aid, so we have a townwide EMS plan, and that has mutual aid agreements for every town. And we work with regional councils. We're actually working on having a separate mutual aid plan, even though there's one already in existence. So we will cover another town if they need assistance. Other towns will cover us within the region. Because you can take all the technology you want to try to predict where an emergency is going to happen, and believe me, people will sell it to you, but again, it's an emergency. You can't predict where that happens. So you can go 12 hours and only have 2 people call 911, or you can go 2 hours and have 70 people call 911. It's just you can never really predict when it's going to happen. So that's why having those mutual aid agreements with other agencies, so that we can all support each other when our systems get taxed. And you know, we work closely with the town, we work closely with the state, we work closely with the hospital, with regional partners, for everything and anything.
Do you have a system on my Apple Watch? If I fall a certain way, it will go off and call emergency. And one time by mistake, literally I was at a bowling alley in Fairfield, and somehow I set it off and didn't realize it.
Yeah.
And so all of a sudden, I get a phone call on my watch from Fairfield asking me if it's an emergency, because I was in Fairfield. And I said, I apologize, I'm very sorry, it was a mistake and stuff like that. Do we have that same type of system in Trumbull? If I fell in Trumbull, would it have gone to Trumbull EMS?
Yeah, so it would be based on like cell tower locations. Like, you know, it would triangulate, you know, if whatever towers you're between, it would sort of triangulate that signal. But yeah, it will, they do work pretty well. There was a little, you know, people were like, oh my God, what's this gonna do? But it's actually, you know, I mean, it will work. It'll tell you location. It is pretty amazing. If you talk to anybody that's had any sort of cardiac issue, from children all the way up to, you know, elderly people, every cardiologist that I know nowadays just like, get an Apple Watch. Get an Apple Watch, put it on. It'll record your heart rate
Give the GPS
24/7.
where you
Yep. If you fall,
and talk, they will come to that.
yep. Yep, they work great. I put a slide up here that said any questions, but I mean, I think we did pretty good with the questions throughout.
We beat you to it.
It's all good. It's all good. I appreciate it. But like I said, we are here for you. If you ever need anything, please reach out to me. Stop by, call, say hello, send me an email.
Thank you.
Yeah. And you know, I really appreciate you guys taking the time. You know, I always tell people, you know, EMSs, as far as if I were to ask somebody, say, what does a firefighter do? Everybody knows the answer, although they do a lot more. But you know, if you ask somebody, what does an EMT or paramedic do? Not a lot of people can sort of say, oh, they do this. You know, it's still new in the overall timeline of the country. And you know, I appreciate, you know, it's something that I'm passionate about, and I really appreciate, you know, you guys having me here, me being able to talk to you.
Barbara for getting you too also.
Yeah, Barbara, thank you. I don't think we can ever have a full appreciation of what you do and the services you provide, especially at the worst times of our lives, usually. I mean, we never see you in the good times, unless there's an open house or something, or
Yeah.
some type of a training that's open to the public.
It's a weird job field to get into when I started, but I always used to say to people, I don't want anybody to get hurt or get sick, but if you do, I want to be there. It's kind of how I looked at it.
I've utilized your services once. I got attacked by a swarm of bees. I don't know how stupid it did something. And I had like, my whole body was kind of one big welt.
Yeah.
And I was getting a little dopey and dozy, and I said, well, maybe I should take a shower and kind of rinse the junk off. And I found that was the wrong thing to do. Because you got to get the blood circulating, get it
Yeah.
further throughout my system.
Open your pores
At any
up
rate,
to-
my wife started to drive me to the hospital, and I said, I don't think I'm going to make it.
Yeah.
So we went back home. We called EMS. And that's the only exposure I've ever had. But I have like a million questions I would love to just sit and play with. Like, how does I don't want you to explain it, but a question might be like, how does the staircase stretcher work? You know, like it walks up and down. I think that's really kind of cool in a way. You know, how does it get out of the vehicle? How does it get back in the vehicle?
Yeah.
You know, you can go on. One thing always just leads to another and another. There's no end to it.
It's true, and it's
Yeah.
you know, it's things that, you know, somebody like me takes for granted, because it's, you know, been my job for many years. But yeah, you know, there's a lot of things, and
You know,
like
a lot of fascinating, interesting mechanisms involved, and technology, and just not to mention the knowledge and the people with their, I guess, their willingness to do what most people don't want to do when somebody's hurt and needs help.
it is definitely a special calling to do it. But you know, I mean, I think you know, I always say it's, you know, whatever you do, whatever job you do, as long as you're you're putting your all into it. That's, I think, at the end of the day, what's important. And
Yeah. I just hope you people are appreciated as much, and like people walk by and they see a guy with the service cap on and say, thank you for your service. You'd almost do the same thing with you people
well, I appreciate
and
it.
firemen.
And we're getting there. I mean, COVID definitely did a lot to sort of, have the general public understand, like,
Yeah.
oh, who are these people that drive around in ambulances? That was a big turning point, I think, for us. And it's still forward progress.
And we're very fortunate at our age to have Barbara available to us at least once a month, dedicated to us. So, Bob, we do appreciate you and your service also. Don't ever forget that. Did you want to make any comment or follow up, Barbara, for us? Nothing?
I just think you did a great job of telling you what EMS is all about.
Yeah,
And
I
that's
never
just-
knew half of it. This is the
That's
kind
great.
of thing you could talk all day long with. I mean, if we ever had coffee and donuts here, you'd never leave.
No. I mean, if you want to put in an application, we could just talk forever. just come work, and we could just, But yeah, no, I mean, I could talk about this, forever.
No, that's really great. We definitely appreciate your time. Definitely appreciate your efforts. Definitely appreciate your knowledge. Definitely appreciate your dedication and the staff that reports to you. So, I don't know. Just thank you so much.
Oh, I appreciate it. Thank you.
And what little we've had today, I hope is a start where something may make this like I don't know, not a biannual, not a semi-annual, but some type of regular updates, if you will.
Yeah.
I think the insurance aspect was interesting.
Yeah.
A lot of people have asked about that. Well, how much does it cost me? Those guys are making money. They're ripping me off. You say, well, think of what they're doing, first of all. You're going to be here to complain about it, maybe, or hopefully.
Yeah, I mean, insurance is definitely an interesting one. I mean, so Medicare is a big payer, so is Medicaid, usually, but the lack of increase in Medicaid in the state, I mean, so if we were to do a call like a paramedic, you needed a paramedic and it was Medicaid, a lot of times the Medicaid reimbursement doesn't cover the cost of doing that call. So if that, insurance struggles are all around.
It's almost like you're thanked at first and damned at second
Yeah.
when the bill comes in.
Yeah. Yep.
It's almost like a no-win situation, but thank you for losing so often on our behalf.
Absolutely. And we will continue to do so. Absolutely.
It's really, really good. I appreciate that.
All right.
Okay. I almost feel guilty saying, we're going to go on with other things, because we could just, I'm sure how was your schedule, by the way? You do have things to get to?
I do not. I think I need to be back by 3:30, and I do have to run down to see if Tom McCarthy's down there real quick.
All right, we'll save things for next time. We'll definitely give you a reason to come back.
Okay, for sure.
I appreciate that.
Yeah.
So
Anytime.
thank you again. Again, Barbara, thank you again. As Mark had said before, thank you for arranging this for us. Much appreciated.
Yeah, definitely. And the files of life, I'm sure Barbara's mentioned them, but take them.
Yes.
If you know anybody that wants that whole box, I brought that whole box up here. Take as many as you want. Just don't take all of them. Share.
What I will suggest is that, I don't know if we should leave some in Town Hall, Kathy, for you, or Cindy, for you, and get the rest to the senior center, perhaps?
I don't know what it is.
It's just a,
So it's a
it's a little red pocket where you put your medical information, where my pills are, what medication I'm on, my doctor is, the hospital I go to is, things like that. Just a lot of good information that's available. And we gave those out a while ago at the senior center, and I'm not sure if it was at a fair that they had at the senior center, perhaps.
These are great.
Yeah.
I would bring them to the senior center.
Okay, I'll get them to Michelle.
I'll keep one because I need.
I'll leave this box here with you.
Yeah, Michelle will have that at the senior center. Well, not today, but by Monday at least. That's cool. Yeah, they are good.
Thank you all for your time.
No, thank you. Really, big time. We should have an award certificate to give to people. Oh, yeah, I did like it. That was cool. Colin Bessick. We were speaking of I'm trying to thought I had something relative to that, but maybe I don't. Can we make a motion to pass the minutes, so we'll kind of get some business out of the way? The approval of the past minutes? Linda, we have a second? Mark?
Second.
Okay, so Mark, and Eve. Slepke did it. So the minutes are done. So we got that out of the way. Done. The reports. Alyssa, anything new? No. Okay, that takes care of that. Senior Center Director's Report. I have a memo from Michelle and Ronnie that they were unable to attend today, so they sent this over to us, and they would like us to read it, so we will do just that. Since last week, we collaborated with the Trumbull Health Department, TPOD, and the Hub to provide Narcan and AED training for 20 staff members and volunteers. The training was successful, and we look forward to collaborating again for the future trainings. I had that training by it was really interesting. You learned a lot of, it's amazing things. Again, you could talk forever about certain things. Our annual tea party, which will be held on Friday, May 17th, limited seats are available. We will have a performance by our tap dancers as well as a Mad Hatter chorus group. Wednesday, May 15th, we will have a group of Madison Middle School Orchestra National Junior Honor Society performing for us at 11:30 a.m. They are a group called Strolling Strings. We will have historian Mark Albertson at the center on May 28th for a presentation. The longest day, June, marks the 80th anniversary of D-Day. Veterans in attendance will receive a small gift. Registration is required. In June, we'll be bringing back our art expo. Art students as well as our needlework group will be able to display or sell their work. Registration is required to guarantee table space. This will be open to the community to attend. It says, please let me know if you have any other questions. Since she's not here, if they have questions, I'd be glad to get them back to her, or you're welcome to call Ronnie Mogensen at the Senior Center. I think 5199, I guess we'll get you to her. Yeah, 452-5199 is the Senior Center number. Oh, yeah, here it is. Oh, by the way, right. 203-452-5199. So, okay, so that addresses the Senior Center stuff. That's taking us. Miss Paulette is not here, and now we come to things that I have. Is anybody in a rush? Anybody? Okay. The reason I asked, I have like a kind of quite a few things. One thing that I want to broach on, which is really cool, is out of sequence of the notes that I had, by the way. I happened to find a memo from January 16th, 2015. What it says senior volunteers with 100 hours may receive a $600 tax credit, and those seniors who volunteer 200 hours will receive $1,200. Was that ever put into effect, do you know, Cindy, or has that been rescinded or changed, or you want? I hope I didn't put you on the spot.
I would have to check that.
Okay.
I don't know off the top of my head. I
Well-
mean, I know we have a program. I think it's something that was adopted by the town council. So if it,
This program, you mean?
yes. So if it has been changed, it would have had to be changed by the town council. Any future changes would have to be done by the town council.
I think the biggest question that I had is that they say that 200 hours, because some people, I mean, I volunteer and I get the $600, which is really nice. But it's been that way, I think, since 2015, apparently, based on this memo. But the 200 hours getting $1,200. There are some people that work a lot more time. I do it 1 or 2 days a week, and that's about it. But there's others that are there. If it's open 5 days, they're there 5 days a week doing stuff in multiple areas.
That question's been raised.
Use your mic, please.
That question has been raised about that fact that I think it goes back even further than, if I'm not mistaken.
Yeah, it used to be
further than
$300.
2015.
It used to be $300 way back.
I want to say in the 80s or in the 90s, it goes way far back, I think. So, because I knew someone who it was with EMS, as a matter of fact, it was a driver. And it really goes back and was getting whatever that stipend was at that, there was a program at that point.
I think there might be a different program for emergency workers,
There it is, boom.
firefighters.
Well, I don't know. This was, I was with EMS in the late 70s, early 80s, and I didn't have that. This was kind of after that, where there was a driver that I knew who did get something. So some kind of program was going on way back when.
Yeah, I don't know about
for-
that.
How would
Cindy,
you qualify it too? How would you know? Here you do because we sign, you know how long we're at these meetings. But someone in the senior center, you don't sign in every time.
We do.
Yes, you do.
Yes,
Yes,
we
you
do.
do.
We put our hours.
Yeah.
In
And
the
they keep
computer.
track of it.
Well, I remember
Yeah.
when it was implemented. So if something was in place back in the 70s or 80s,
Right.
I think maybe it was gone. Because I think
Could
this
be.
was new when it was put in sometime in the 20-teens. I'm not sure exactly when.
Yeah.
Okay,
Were you in grade school then?
I found something interesting also that has me kind of questioning what I have here. Is that this memo is from 2015, because it says qualifications, beginning with the grand list of 2015 qualifying taxpayers who volunteer 50 hours of service to the town of Trumbull shall be eligible for a tax credit not to exceed $300 upon his or her property taxes in accordance with the provisions hereof. And then this one is 2015 also, in the beginning of the year in January, and it says 600. So at any rate, the current rate is what's key. And I guess the question I'm trying to get to is that, does administration, I guess you're always evaluating policies and procedures and things. And am I wrong in that I heard somewhere that this might be one of the things that is being reevaluated currently?
I don't believe it's being reevaluated currently, and like I said, this would have to be approved by any changes would have to be approved by the town council. Why don't I take a look at the program and see if I can
Thank
gather
you.
some information for you,
Yeah.
and then we can take it from there.
And they determine maybe how to go about having it readdressed.
I mean, it's always a good idea to review these things periodically, see if they're due for an update.
Well, I know I'm kind of jumping in. I apologize for
No,
that,
that's okay.
but if we were giving $600 in 2015, here we are. What, almost 9 years later? Same number. Things ain't equal to the way they were then.
Yeah,
You also
it's
have to be over 65.
Oh, this is a town-wide program, by the way, that's applicable to. Please correct me if I'm wrong, Kathy. Kathy, why couldn't Kathy? Cindy.
I get called Kathy all the time by a lot of people, so it's fine.
But
I'm
it's
used
a
to it.
program that's open to, I think, it says seniors, which I assume is 65 or disabled and above, to any town department that can utilize you. It's just that many departments don't really have, I don't want to say enough of work, but the staff there is handling it.
Or the
this-
type of work
or the
that would
type
be
of work, yeah.
appropriate, right?
Whereas the senior centers, like there's a lot of things that have to be done, and there's really no
Right.
people to do it, so
Right.
volunteers step in.
Right, right. I will take a look. I'm sure it's very specific as to who, what the requirements are to participate in the program. I know, but you seem to have a couple of
This is
different.
the current one. And by the way, this program, along with our Commission on Aging, is on the Senior Center site. And I'd like to take issue with that. How come we don't have our own site? It may be very small and limited, but we originally were the Senior Center Commission. You remember that?
Correct,
And that
correct.
was changed, the
Well,
emphasis was
sen-
changed
it
and the
was the
direction.
it was the senior commission.
Okay.
It was not
Yes.
the senior center commission. It was the senior.
But the
commission.
senior center was the focus for everything because we had not a budgeted amount. We had some discretionary funds to give to
Right.
the center.
Right.
So we kind of assumed responsibility for them. Once that discretionary money was put into the general fund, like the excess from the EMS people, it was gone. We lost all of our kind of sway or impact on the senior center,
Well,
which wasn't a bad idea in
Right.
hindsight, but
right. So we have a great staff, Michelle and
Yeah, oh,
Ronnie
yeah.
and her staff, and they run the senior center, and they decide how the funds should be spent.
Now.
Yes, yes. So the charter that was approved in 2020, took effect in 2020, renamed the Commission on Aging, and sort of defined it.
Yeah, I remember Vicky came into the meeting and said we have to refocus our direction.
Right.
It's more universal. It's not
Right.
just a senior center.
Because back then, if Michelle wanted to have a luncheon, she would come to the senior commission and ask for permission to buy tablecloths.
Yeah.
Right? And it doesn't.
Yeah.
Yes.
And then the question was,
it
well,
doesn't make sense.
how far did you look? How many people did you approach? She said, well, I know it's like $300 for whatever. It's okay, we'll allow you up to an expenditure up to $350. Anything over that, come back and justify your request.
But it's your commission is what we call an advisory commission. So we have some boards and committees that they make legally binding decisions that are subject to court review, or there's a difference between the town council and board of finance and planning and zoning, and then we have a conservation commission is advisory, and it's not to say you're not important. It's just a different function, and determining how funding is spent. Michelle and her staff should do that. They have a budget. They have certain, specific protocols that they follow when spending their money. So, that's why that all changed.
Oh, I understand that.
Yeah.
As a matter of fact, I recall Mrs. Tesoro when she came in and said your focus should change
Yes.
to an advisory committee and back off of the senior center as your primary, sometimes your only focus. The problem we still have, though, I guess, which is not really a problem, at least we have access, is that anytime we want to do a mailing or something for a group of seniors, the easiest place to get that information from, or a list of people, is from the center, because they have the membership records.
Correct.
And that's an easy group to kind of initially approach and then propagate it to the total population, if applicable.
Well, I think if you have plans for outreach to seniors, which I think it's a good part of what you're here for, is to determine the needs of the seniors, and if you find that there's a way that you'd like to reach out to them, whether it's by a mailing or something else, then you should definitely come up with a plan. What is it that you want to do? Who do you want to send it to? And we can work to find, either do we wait until the next budget cycle and find you some funding for that, provide you with some funding. Does Michelle have room in her senior center budget is it a fit? Is it permissible to use that money that way? It may or may not. But I think if there's something specific that you want to do, you should definitely, work on that. Whatever you come up with, then we can look at how to make it happen.
Right, I agree with that, but to being a little more specific about it, with the senior center, we have approximately 1,500 people we have direct access to through the mailing.
Mm-hmm.
I think initially we spoke of doing something, and I'm not sure what it was, a fair, bazaar, or something relative to the seniors. We wanted to do a mailing. We have no budget for that.
Mm-hmm.
The other thing we thought about was embedding it into the tax mailing when the tax bills go out, but that
Right.
presented a whole other problem.
Right.
And that's where we have total access to the total
Those mailers are
retirement base.
prime real estate.
Hey, well,
There's very
yeah.
limited what we can put in the bills. But if it's something that fits with the senior center's mission, then it's possible that they could use their mailing list. It's possible, but it depends on what it is.
We wouldn't have any kind of read-only access to, say, a tax database excluding whatever personal information might be in there for mailing if we chose to something like that.
Well,
Is there?
I'll tell you that, especially during COVID, we sent postcards specifically to seniors with important information, because we recognize that a lot of seniors might not be checking the town website every day.
True.
or every week. And if we had some really critical information that we wanted to get out to people regarding availability of vaccines in the town, and it just things that we needed to get out. And we did reach out to Michelle to see if there was anything that she felt needed to be included on those postcards. It's not something we do on a regular basis, and really it was more of a COVID-related thing. But that's an instance where, we were able to get information out. So, it would depend on what messaging you want to get out. And like I said, we might be able to find a way to make it happen.
All right, we'll try and kick that around, have some,
Yeah.
hopefully some constructive thoughts on doing something en masse. But, and if you would like copies of this, I'll make you copies of these before we leave, of the volunteer program relative to 300, 600.
Sure, and I'll check into it for a little bit. I'll find out some information, and maybe I can get statistics on how many people take advantage of it and what jobs they're doing. And
Where'd you get
yeah,
People,
yeah,
we probably have the most,
yeah. You might.
really,
I had
Yeah.
this in my folder, and this I got at the site.
else, except for
somewhere.
EMS.
No, no.
Yeah, I really.
Fire,
Yes.
have,
No, this is
Yeah,
current.
but they're not, usually they're under 65. Only 65.
well, yeah.
Yeah, I think there's
65.
a separate program for
Yeah.
fire, for volunteer
Like
firemen.
the over 65,
Yeah.
probably primarily the senior center.
Well, I'll
Run it,
I'll do some research and
yeah, we really do.
yeah, yeah.
That's how it is.
And thank you for all of the work that you do,
Lot of fun.
those volunteers.
Okay, so
Yeah.
that's,
A lot of fun.
that's
Yeah.
done.
It's a great place.
Oh yes.
Okay.
We have the best.
handicap.
Okay, good
The
community.
town doesn't charge
And
car
the-
tax.
and the
for people
pantry's
who
the best.
charge, transportation. But I made contacts in my family who lived on the sun, and we
Nice. Well, not that it's big, but that's nice.
No, it's wonderful.
Yeah.
I was
That's
totally
something.
unexpected all of a sudden to have a village.
Okay. So, thank you, Cindy.
You're welcome.
Also known as Kathy. I have quite a few other things here that I'm just going to run through. I think what I mentioned before about we are located at the senior center site. Alyssa, did we speak about some time about trying to get more exposure for the commission somehow? Or am I just? I mean, maybe we did, maybe we didn't. I got a lot of things just kicking around.
I'm not computer savvy enough to do any of that.
Well, maybe we should. We have to kick that around. And I think Eve was going to look at maybe some publicity stuff. So I don't know what the status. No. Oh, Evie. Eve 1 and Eve 2?
No,
Younger and elder?
she's Evie.
Evie. I would call her Evie.
Her name is Evelyn. So
I guess everyone knows that there was a community facilities building committee yesterday at the senior center, which I think was pretty well received. There were a lot of questions. There were some people who had a lot of questions, which I kind of felt bad because I don't think they had all their questions answered. But I think in light of time and moving things along, they had to limit them to like 4 or 6 questions. So that came up pretty good. What I say? I guess the key takeaway is that the current design has been approved, which is not down to the specifics. It's more, I think like they said, it's just a conceptual plan at this point. Once it gets any kind of formal go-ahead from the town council, then you get a little more specific. But I guess the town council may request a question and answer session at some point in time, perhaps. Okay, at any rate, another thing that I haven't found is a thing called recreational facilities. And I don't think people are aware of it, of how much, I know I have it here. I really, really do. This is from, again, another historical document. This is from 9/14/06. They talk about the Abrams Nichols Park, the Aldo Memorial Park. Never heard of that one. Beach Memorial. No, Aldo Memorial Park. Abraham Nichols Park. Beach Memorial Park. Davidale Park Jones Estates, Revere Lane, which is a hiking trail and the playground. Great Oak Park.
Oh, yeah, that's on Dayton Road.
Yeah, I had never heard of half the trade.
School.
Indian Ledge, Island Brook, Cat's Pond. That's where the VFW Center is going to be going? Okay, Cat's Pond. Ketchel Farm.
Yes, you go there, right.
I
next
do.
to- yeah, right next door to Madison Junior High. That empty field.
Soccer fields.
Oh, in back of it, you mean?
No, this to the left,
Oh,
the cornfield.
You have to get out more, Ron.
I go to the Madison campus every day, the back building. Where Reach
To the left,
reaches.
To the left of the building.
Yeah, that's right, way in the back. By the baseball diamond, baseball fields.
No, baseball, it's
Yeah, it's-
soccer or something.
No, there's a baseball field, in back of the soccer field.
Oh, okay.
And there's always goose poop on the track by it, but that's another story. Here's Mishy Brook Park. I never heard of that. It's on Booth Hill Road. Nothingale Memorial Park.
Nagel.
I had never heard of these
Right next to
places.
the cemetery.
Old Mine Park. There's Parlor Rock. Packanack River Valley Park. Pondview Scenic View. Spring Hill. This is a baseball field. Tasher Knolls Golf Course. Twin Brooks. We know all that. And Unity Park. Is that that's where the Bunny Farm statue is or something?
No, Unity,
Unity Park is the
Next to the farm.
biggest baseball complex in the town.
Oh, by the
next to the
two
Merritt Park
funeral
Way.
homes in back.
where the funeral
They
home
used to have just the two
Behind the funeral home.
Little League fields, and then they built a Babe Ruth field, and then they built the other.
Yeah, there's a whole
softball fields on
complex
the other
back.
side.
Okay, well, but I mean, I found this and I was amazed. I never knew we had this many things available, and I think something came out. I think the first selectman mentioned it yesterday about that Trumbull has more
Open space.
open spaces than any other town in the state
Of our
the
population.
of our population. But the problem is, not much of it, if any of it, is buildable. So that's kind of like a blessing and a bane at the same time. You can't have more ratables, but we've got the open spaces to enjoy. So choose what you like. Takes care of that. What did I do on that? Recreation facility. I did that. Let me care about that. If anybody's interested in the vet first responder building, phase one has been completed. The septic system and the foundation bids have been awarded to Nagy Construction Company, I think that's the name. Nagy Brothers Construction. That's going to be completed hopefully late summer, maybe. And phase two, which is erecting the building, the contract will be awarded with construction to begin hopefully sometime in September when it goes to bid. So that's a pretty aggressive time. I hope that works out. Groundbreaking is tentatively set for May 10th at 11 a.m. this year. You know, get just a symbolic shovel in the ground and throw some dirt around. We spoke of that. I'm running out of things rapidly here.
The new Indian Ledge complex is 3/4 of the way done. They already have the field laid out, they've got the poles for the lights, and they have to put the AstroTurf, they're supposedly be done by sometime in June.
I'd like a professional field.
Oh, it's going to look fantastic.
That's cool. Okay, we don't need that. This is on the current site, but anyway, just this is from March 15th, 2024. Was about the $1.2 million grant of for the Veterans First Responder Building, and they're just giving a lot of credit of who was instrumental in getting it. Senator Blumenthal, Chris Murphy. I don't want to miss anybody's name if I can help it here. Sarah Crete was helpful in getting some more money and Marilyn Moore also. And I'm sure there's many other people. I apologize if I haven't mentioned all the names of the people who are instrumental. Arena, by the way, did a bang-up job with the funding and grants and whatnot for things. Trying to think if I have anything else here to go through. No, I think I've worn out my welcome at this point. So we're done with that. I kind of wrapped up old and new business in everything we just went through, which, at any rate, the last item on the agenda states our next meeting is May 24th, 2024. And May is a great month. It's my birthday month, my anniversary month, and we're not going to speak of any dates or time frames, whatever, but it's a good month for me.
Is it here again? Do you know if it's here or at the senior center?
My anniversary? you mean?
The meeting.
Oh,
It's here? Thank you.
yes. The 28th, we're at the senior center. July, we have no meeting, so make your vacation plans if you like. And
No, June
28th at the senior center. Yeah. And then July, there's no meeting.
Correct.
Does anybody have anything else for the good of the order? Any comments? Want to say hello to anybody? Goodbye? All right, no comments. The public, other than that, can we call for an adjournment? Anyone? Someone?
I second.
Carried. Thank you very much. We apologize for if we rambled on quite a bit, but I think it was a pretty interesting meeting today, especially with Colin being here. Good man. Seems like a good man. I like that. A lot of things I never knew. Okay, we're done. Wrap it up, Rich.